Let's start with the first section of our lecture, Babesiosis. And in this section, we will talk about the incidence, how common it is, Babesiosis, what are the causative organisms of Babesiosis, how it is transferred or transmitted, what's the mode of transmission to the humans, and also the pathophysiology, what are the different stages that ultimately can lead to babesiosis. And then the Babesia microti is the most common causative organism, so that's why we will discuss both babesiosis and Babesia microti in our this first section. So what is babesiosis? Here you can see it's an emerging tick-borne infectious disease. Lot of diseases, infections are now caused by the tick-borne infections, including Lyme disease. And so this babesiosis is also tick-borne infection. You can see the ticks that can cause babesiosis. So it's a tick-borne infectious disease caused by protozoan parasite of the genus Babesia that invade and eventually lyse red blood cell. So it's a protozoan parasite. Mechanism of action is the same as the malarial parasite. Malarial parasites also cause involvement of the red blood cells, erythrocytes. So in this, it's a tick-borne disease that involves the red blood cell and cause lysis of the red blood cell, means destruction of the red blood cell, and so many symptoms can occur as a result of destruction of the red blood cells, because now the red blood cells cannot perform their normal function, which is the transport of the oxygen, and they carry hemoglobin, so anemia can also occur, the other conditions which we will discuss later on. So mainly it's a tick-borne disease that cause lysis of the red blood cells in the humans. The incidence of the babesiosis is, most cases are due to Babesia microti, and that's the diagram showing the tick that can cause the infection. So most cases are due to Babesia microti. Occur in the United States, particularly in the Northeast and Upper Midwest region of the United States. Mild in young, so usually young individuals who get this infection or infestation, they have mild babesiosis, mild illness, not the moderate or severe type of illness. So mild illness occur in the young individuals. Severe and fatal illness occurs above 50 years of the age. So it's not very serious in the young age. It's more serious in the age groups above 50 years. So it's a tick-borne disease that causes lysis of the red blood cells, more common in the, more severe in the age above 50, mild in the young age, occur in the United States. Most common causative is the Babesia microti. Five-fold increase in the incidence over past decade. So it's increasing in the incidence of the babesiosis is increasing. So it's a five-fold increase. It's a big increase in the past decade. Markedly underestimated because symptoms are non-specific. It's non-specific symptoms because they are not specific can lead to underestimation. The number of the cases reported are less than the actual number. Why? Because it's mainly miss the specific symptoms that are very important for the diagnosis of the illness with the specific symptoms. In this case, the specific symptoms are missing, so it's underestimated, or we can say sometimes can be misdiagnosed. Fewer than 50 cases of Babesia divergens-like, and Babesia venatorum infections reported. So other species of Babesia are not very commonly associated with the illness. The most common Babesia is Babesia microti that can cause Babesiosis. So that's the organism which we will discuss in detail. The rest species are about less than 50 cases are reported. Babesiosis caused by Babesia duncani and Duncani type organisms. They are sporadic, and they have also few cases of these species are reported. Etiology of Babesiosis is phylum Epicomplexa. Protozoan. It's a protozoan parasite that cause malaria, toxoplasmosis, and cryptosporidiosis. These are some other illnesses that are caused by protozoan parasite. As I mentioned, malaria is caused by malarial parasite, and again that cause destruction or involvement of the red blood cells or erythrocytes. 4 clades of Babesia species infect human. We already mentioned them. These important species are Babesia microti, less than 3 micrometer. Micro is small. So Babesia microti is small in size, less than 3 micrometer. So it's microti, Babesia microti, most common organism that infects humans. Then we have second number, Babesia duncani. Then we have Babesia divergens and Babesia venatorum and large Babesia. So these are some species of Babesia that can cause disease or illness in the humans. Mode of transmission, how this infection or how babesiosis can spread. In the United States, Babesia microti transmitted to humans by nymph stage of deer tick, Ixodes scapularis. So, it's transferred to the human by the nymphal stage of deer tick, Ixodes scapularis. So by the deer tick, the infection spread to the humans. From May through October. So the time period during which the spread is common from the May to the October. So it's more illness or infection of the summer. 3/4 of cases presenting in July and August. Causative agent and their vector, how they are, or what's the vector that carries the causative organism. Babesia duncani, Ixodes pacificus. Babesia divergens, then we have Ixodes dentatus. Babesia divergens and Babesia venatorum, again Ixodes ricinus, and then we have Ixodes ovatus tick. So these are the causative organism and the vector that carries them and then spread them to the host. So these are the causative agent and the vector of babesiosis. Transfusion of blood or blood products is another mode of transmission. Transfusion transmitted cases occur year around. So instead of May to October, or the most cases in July and August, the transfusion or transmission of this infection through blood transfusion, we can see the cases that can occur all year around as a result of blood transfusion. Most frequent from June through November. More than 80% of cases in endemic areas are present. Now the pathophysiology, how the infection spread, and we already mentioned the nymphal stage carries the infection to the humans. So we have humans are the dead end hosts. So once the infection reaches the human beings cannot spread the infection, or there is another host. So the dead host is the human. Subsequent transmission occurring from ticks feeding on infected person is rare. So once the infection occurs to the human as a result of the tick bite or ticks carrying the causative organism, then the spread of infection is rare from the human. Human to human transmission is only through the blood transfusion. So if the infected individual transfuse the blood or donate the blood, then it can cause infection to the recipient. So it's through the blood transfusion. These you can see infected sporozoids of the protozoan invade the erythrocyte, and these transfer during feeding. Sporozoids invade erythrocytes, red blood cells. Then we have binary fission occur, asexual reproduction, and as a result of that, the sporozoid become merozoites. Then in fact, the additional erythrocytes form gametocytes. Then there is gametogenesis, ray bodies, zygote is formed. Then we have kinete, multinucleated sporoblast. Then we have again sporozoids released, and these sporozoids again. So it's a cycle. The tick is transferred first from the tick and from the white-footed mouse. You can see the white-footed mouse is also the mean of spread of infection and the tick bite. The sporozoids, then they invade the red blood cell. More and more red blood cells are invaded. Sporozoids become merozoids. Then we have gametocytes, gametogenesis, and then they again at the end become more sporozoids, and they keep on affecting the red blood cells and cause destruction or the lysis of the red blood cell. So lysis of the red blood cell as a result of infection, when we will discuss different forms of babesiosis, mild, moderate, severe, we will see what are the clinical manifestations and how the patient will present. But the anemia is there, lack of supply of oxygen is there. As a result of that, different more complicated things can occur. So main mechanism by this which is causing the problem is by invasion of the red blood cell causes lysis of the red blood cell, and usually the humans are the dead end host. From the humans, the infection can transfer or spread by the blood transfusion. So that concludes the section 1. Thank you for watching sqadia.com.